Hi, my name is Indy Lane and I'm the Medical Director of the Fishers Health Department. I want to first start by telling you all thank you for all that you're doing to help decrease the spread of COVID-19 in our community by wearing a mask every day. Because now masks are a very important part of our everyday lives, I think it's important to take a little bit of time to make sure that everyone understands the different types of masks that are available. All masks are not created equal, so it's important that we understand which mask we should be wearing and how we should be wearing the mask so that we can keep ourselves and the people around us safe. Many of you are familiar with N95 masks. There was a lot of discussion about N95 masks at the beginning of the pandemic because this was critical for healthcare providers who were taking care of very, very sick patients. The N95 mask is designed to fit very tightly over the nose and the mouth of the individual wearing it. As you can see, it has elastic bands. It has no vent. It's designed also to prevent the inspiration of very, very small respiratory droplets, as well as the large respiratory droplets. These masks are critical for healthcare providers that are doing procedures or in close proximity to individuals, and they're doing procedures that are going to cause small particles that potentially could have COVID-19 to be dispersed into the air. There are other N95 masks like this one that have a vent. These N95 masks also fit very closely, tightly over the nose and the mouth. They look very similar with the exception of the vent. These masks are not designed for infection prevention. These masks are designed for construction workers who are trying to prevent inhaling small particles of dust or whatever material they may be working with on a particular day. It's important for you to understand that if you wear an N95 mask with a vent or even a cloth mask with a vent, every time you exhale, you're allowing the air from your nose and mouth to be exhaled into the environment such that you're not keeping the people around you safe. So any of the masks that you see that have a vent are not good for infection prevention. I understand that they help some people feel as though they're breathing a little bit easier, but they're not really good for preventing the transmission of COVID-19. Another mask that we're familiar with is just the plain disposable surgical mask, and many of us wear these in the community. These are inexpensive, comfortable, they are oftentimes fluid resistant, and they will filter larger particles. And for most of us in our day-to-day lives, this type of mask is sufficient, provided that it's covering our nose and our mouths. A mask provides no protection to you or the people around you if you only have your mouth covered. So again, it's critical that your nose and your mouth are covered. It's okay if these types of masks aren't secured really tightly to the face like an N95 mask. The most important thing is that it can capture respiratory droplets when you talk or cough or sneeze throughout the day. Other masks that are perfectly safe and a good way to prevent infection when you're not a healthcare provider and when you're just going about your day-to-day activities is a cloth mask. Again, this should be worn over your nose and your mouth. You should wear a mask anytime you're indoors and you cannot social distance, particularly in public. If you're at home with your family, no one is ill, you certainly don't need to wear a mask. However, if you do have someone in your family who has symptoms that are worrisome for COVID or they are feeling ill, I would encourage everyone to wear a mask. If you yourself are feeling ill, then you should wear a mask. You should isolate yourself and contact your healthcare provider and consider testing for COVID-19. If you're outside exercising, you are exercising with household contacts, people you live with, there's no need to wear a mask provided that you're not around other people that you cannot social distance. So in addition to masks, having that 6 feet of distance between you and other people, particularly indoors, is critical to us reducing the spread of COVID-19. Keep in mind, we're still learning a lot about COVID-19. I know it's frustrating that so many things are constantly changing, but the more we know and the more we learn, we try to communicate best practices so that we can keep our community safe, we can keep our businesses open, we can get our kids back in school and learning. So thank you for all that you're doing. It's a pleasure to be able to serve the community and the city of Fishers, and look forward to talking to you soon.